what it means to me to be a surgeon of excellence is that somebody has looked at my results and confirmed what I already thought. That I think I do a really good job. I think compared to my peers, I think I am a high volume surgeon. I think I get really good outcomes. I have happy patients. And I think when you have somebody else that can actually pull your data, look at it, and who also has the data of other surgeons around the country, and can look at my stat data and say, you know what, this surgeon does a lot of operations and he does a really good job, very low complication rate, very successful. So I like having a third party tell me what I think I already knew about myself, and hopefully that'll give patients a little bit more confidence in us. So the Center of Excellence distinction was important for us to pursue because it really shows the public that we're different. We have a little bit more, we have more volume, we have higher standards, and when you're comparing surgeons, you know, it's hard. Yeah, for me as a physician, I have family members that call me all the time wanting to know who should they go see in their town. Well, I really don't know because I don't know all the surgeons. I can tell you who's good in my town because I'm an insider. But as an outsider, it's hard to pick a surgeon. So having a third party that goes around the country looking at surgeons' data, looking at their outcomes, and being able to tell the public, this guy stands out from the rest, I think that's important, not just for us, but for the public. So the Center of Excellence process involves us presenting our case logs, the amount of procedures we do, the OR data, and the post-operative data. So they're looking at how our patients did in the hospital. They're looking at how our patients did out of the hospital. They're looking at how well we did in the operating room. They looked at the type of patients we did. They looked at the, you know, we're not just doing their easy cases. We're doing very high-risk patients and still having good outcomes. So I think looking at all of that information and being able to compare us apples to apples around the country and have us come out as a very distinguished program is important for us. I think it's important for patients to know who's actually working with them. And I say working with them because as a surgeon, I don't necessarily think that I work on a patient. I actually work with the patient to have a better outcome. And I think when the patient understands how we're going to pursue their surgical treatment, they're going to do better. And as a partnership, me and my patients, I think we do really well.